Are you going to perform an arterial blood gas or cannulate the radial artery? Stop. Before proceeding, you would want to assess the collateral circulation to the hand with the modified Allen's test. Hello, I'm Dr. Collins, and in this clinical examination video, we're going to take a look at Allen's test, a simple bedside test used to assess whether there is adequate collateral blood flow to the hand. So let's recap what this means. The hand has two main arterial supplies, the radial and the ulnar arteries, which anastomose through the superficial and deep palmar arterial arches. This interconnected network allows blood from one artery to help maintain perfusion if the other is compromised. However, around 4% of the population is estimated to have inadequate collateral circulation. In other words, if one artery is damaged or blocked, the other may not be able to compensate and maintain adequate blood flow to the hand. So, if you perform an ABG or cannulation of the radial artery in someone without this collateral circulation, any damage or occlusion sustained during the procedure to the radial artery could result in compromise to the blood flow to the parts of the hand supplied by that artery, potentially causing ischemia and, in severe cases, tissue necrosis and even loss of some digits. So before proceeding with an invasive procedure involving the radial artery, make sure to perform the Allen's test, especially if this is a non-emergency access situation and you've got that extra few seconds. In order to perform Allen's test, ask the patient to rest their hand palm up. First, identify the pulse points of the radial artery on the thumb side of the wrist and the ulnar artery on the little finger side. Now ask the patient to clench their fist while you apply firm pressure over both arteries simultaneously. You can ask the patient to open and close their hands a few times to facilitate this process. Now ask the patient to open their hand while you continue to maintain pressure over both arteries. The palm should now appear pale or blanched, indicating that we have temporarily stopped arterial blood flow to the hand. Now, while continuing to compress the radial artery, release the pressure over the ulnar artery. What we need to do now is observe how quickly the normal color of the palm returns. A normal result is a rapid return of color, usually within 5 to 7 seconds, suggesting that the ulnar artery is providing adequate collateral circulation to the hand. If this is the case, it is safe to proceed with radial arterial access. If color takes longer than 7 seconds to return, this may indicate inadequate collateral circulation. Thanks for watching. If you like this video, please like and subscribe to fuel the passion to create more videos. And don't forget to check out our other clinical videos on our channel. Good luck!